blood gets taken out of your body, it becomes ozonated and oxygenated, passes through a filtration system, and then gets given back.
Hi, I'm Dr. Josefina Benincasa-Feingold, and this is Valley Health and Hyperbarics.
EBOO stands for extracorporeal blood oxygenation and ozonation, which means that extracorporeal means out of your body. You have to put it in two lines, because from one line you take it out, on the other side you bring it back in, because if you take out 2 liters of blood, it would be very dangerous. So that amount of blood, you take it out and put it in all at the same time. So you need 2 large bore IVs, one that allows for free flow of blood out. It gets ozonated, oxygenated, and passed through a UVB prism, and then oxygenated blood comes back into your blood. And the whole process takes about an hour and a half. So I just want to explain the 2 differences. There's regular ozone treatments where you put in an IV line, you draw blood out, you mix it with ozone, and then you give it back. That only takes about 60 milliliters, so 2 ounces of blood. As opposed to this, the EBOO, which it takes out 2 liters of blood. What you do is you put in a line, you draw out, you put in an angiocatheter that you're putting in an IV, and you hang a bag like a normal saline, and then you draw back 60 mLs of blood. You put that 60 mLs into a bag that has normal saline, and then you take a syringe that has 60 mLs of ozone, and you squirt it in there. Ozone is not stable, it's O3, as opposed to O2, which is oxygen. So what happens is that when the ozone comes into contact with blood, it denatures, it goes to the more stable oxygen, O2, and you hyperoxygenate this blood. What that does is it has a property of anti-inflammation, anti-inflammatory. You hear about inflammation all the time. This is a way of bringing down inflammation. And so you let that blood that is super oxygenated drip back into the patient. With EBOO, the amount of blood that is taken out is it's about 2 quarts of blood. So that would be a lot of blood, right? And it could be dangerous. If you bleed out 2 quarts of blood, that's a lot of blood. So the way that it's done is it is taken out on a continuous basis and put back in on a continuous basis. And in the process in between is a continuous ozonation, oxygenation, and then it also passes through a prism that has, so blood can be exposed to light therapy, like the photodynamic therapy. It's a UVB light, which is supposed to have bacteriostatic or bactericidal and virucidal effects. And what EBOO will do is it will give you a dose of anti-inflammatory properties. So people generally start to feel better right after. So what happens is you have to understand physiology. You have to find a way to take blood out, not endanger the patient, put blood back in. That has to be a closed system, because you don't want to introduce bacterial viruses. So this is a closed system. It looks like a big cylinder, but it has many little tiny cylinders that are crystal. The blood goes up into it. It becomes filtered, exposed to ozone, and then it goes through a smaller prism that UVB light. And then at the end of that, it goes back into the patient. And if you look at both tubes, the one that takes blood out and the one that puts it back in, you see a big difference between one and the other. So if someone has tonsillitis and it's strep pharyngitis, you treat them with an antibiotic. If somebody has appendicitis, you go in and you take the appendix out. Mainstream medicine doesn't always have an easy solution. Sometimes we have to think out of the box, and this is one of the tools that we use. So there's a lot of research on ozone. It was started in Germany. Frank Schallenberg, who is the guru, he wrote the book on ozone treatments, and he trains everyone. I trained with him. That he's out of Nevada, and he brought this to the United States. So the premise is that when you expose something to ozone, which is O3, it quickly hyperoxygenates all tissues. There are different ways of administering ozone, doing it with mixing it with the blood. There are other ways of just ozonating normal saline and getting the activation. But EBOO is the largest method of administering ozone. And the way that it's done is the safest. The one catch is that you need to make sure that somebody's in the room with the patient monitoring blood going out and going back in, because obviously if you have a pump that's taking blood out constantly and not putting it back in, to put the patient in danger. So once we set the machine up that it's taking blood out and putting it back in, what we do is we're constantly monitoring.